The most important thing in implant treatment is the actual planning the case and the three-dimensional position of the correct size implant. Now, we don't want an implant that's too big, but we don't want an implant that's too small. If the implant's too big, it takes up all the tissue. So for an implant to stay, it has to be surrounded by healthy tissue with some space for blood supply and not too adjacent, too close to the tooth, because the bone can die back around the tooth if you get too close to the tooth. So we basically want the biggest implant that will safely fit the space, allowing enough space between the teeth and enough space around in the three-dimensional map of the bone. So implants come in different diameters. This is a 5mm, 4mm, and a 3.5. The trouble is with a 3.5mm implant, you actually have more bone around the implant, but the walls of the implant get very thin, and so the implant can fracture with a heavily loaded molar over time, and also the screw can come loose and break because the screw is slightly smaller and this connecting interface is smaller. So there are prosthetic complications with going too small, and there are also biological complications by using up all the bone and getting too close to the teeth if you go too big. So all these factors have to be considered when the implant is planned. Now, most of the problems that I see with implants are placement issues. So this is a case that was referred to me where the implant is too close to the adjacent implant. They're actually different depths, and we've actually lost all the bone around this implant and the adjacent implant, and it tends to get infected and jump from implant to implant. So what we did is we removed this implant and repaired this and saved the situation. So we have to be very careful that we don't cut into the adjacent tooth. Sometimes the tooth is tilted on an angle and the crown and the root are at different angles. So you look at the crown, you're placing your implant, and you can get too close to the tooth. So that's another reason why I like surgical guidance, is you can pre-plan this on your scan and get a safe distance from the tooth. A large number of, or large percentage of the problems with implants is just incorrect choice of implant diameter and incorrect position. It sounds easy, but implant placement takes quite a bit of practice, and you need skilled hands if you're going to do it freehand. Surgical guidance eliminates or helps avoid a lot of these errors by better planning and controlled placement. Now, this particular case on the left-hand side is that implant has survived, it's successful, but it's an aesthetic nightmare because it's a long tooth. I like to think of it as a banana, simply because the implant, when it's been placed, it's the bone on the inside is denser than the bone on the outside. So as you go up a drill size and drill for the implant keeps coming forward, and so the tissues tend to thin out, and there's just not enough thickness of tissue over the implant. So as it heals, that thin bone tends to die and resorb back, and then you have a long tooth. So that's an angulation positional error. So the depth is correct, but the angulation is off. This one here is we're too close to the tooth. And again, there's no space between the tooth and the implant. This is an exceptionally hard place to clean. And if there's something wrong with this tooth and this tooth is extracted, there's a good chance when the tooth is removed there'll be significant damage to the implant, and this implant will be lost. And also this overhanging here, because it's not centered, it will collect plaque, and it's very hard to floss and clean underneath this ridge lap or overhanging design. This implant case here, the implant wasn't even placed in bone. That's the head of the implant. The implant should be about 3mm below gum at bone level, and this is 3mm above gum. I think they read the instruction manual the wrong way up. So that implant was replaced, and we grafted up the hole and converted that into a bridge. Because these crowns were poor design as well, we took this crown off here and this crown off here and just made this a bridge and didn't do another surgery. This is another case where we have too many implants close together. Now there's not enough space to provide healthy tissue. What happens is this little bit of gum and bone between here. There's not enough thickness of tissue to develop a healthy blood supply and also to be able to clean. And the design of the restoration that was placed on the top also doesn't allow cleaning the implants. And all those implants are in trouble. There's 10 implants and they're all in trouble.